Have you ever wondered who ensures that hospitals, clinics, and insurance companies are all running smoothly? That is where healthcare administrators come into play. In this video, I'm going to break down what healthcare administration really looks like in different roles, tasks, and how you can make a difference in this critical field. So, who am I? I'm Dr. Ashley, a healthcare administration professor and advocate for the next generation of healthcare leaders. My passion is helping new administrators step into their roles with confidence and purpose. I really believe that by bringing fresh, motivated healthcare administrators into the field, we can create a better system that's not only efficient, but truly concentrates on the patient and is more compassionate. So, what is healthcare administration? Healthcare administration is all about managing the business side of healthcare delivery, right? It's ensuring that providers, patients, systems, and all of that is just working together smoothly. Okay. We all know about healthcare practitioners, the clinicians, the doctors, the nurses, other technicians, healthcare providers. They're out there interfacing with the patient. They save lives, right? They work on the patients. They're the ones doing that work. The healthcare administrators make sure that they have the resources and the staffing and the systems that will go together and help them operate more effectively. Okay, so that would be our role. We have to make sure that the systems are working properly. All right. So there are tons of different types of jobs within healthcare administration. On this channel, if you've been watching some of my videos, I talk about this all the time. I know I briefly mention it sometimes, and then other times I might get into tons of different roles, different jobs that healthcare administrators are actually part of, different types of jobs in the field. But I'm just going to go ahead and highlight some of the diversity because the field of healthcare administration is so vast. There are so many different settings that you can work in healthcare administration. And the workload can go from very heavy workload where you're stressed out, you're doing a lot of things on your feet, all the way to something that's very chill and easy. Just sitting in a calm office and you're just managing a few things in like a medical clinic, small medical clinic. You can be working in insurance. You can be working in research and development. You can be working in any kind of pharmaceutical company. You can be working in a hospital, in a small clinic, and really just about anything that has to do with healthcare. Okay, there's so many different places and you can go in healthcare administration. You can even get into consulting if you are really good business minded and you understand the way that a lot of these companies operate and you know what's needed. You can be a consultant that is going to help a lot of these facilities operate more effectively. So consulting is another thing that you can go ahead and do in healthcare administration. So it's wide, it's crazy. And that's why if you're trying to become a healthcare administrator, you really need to figure out exactly what you like in the field, where you think you might be able to see yourself and then focus on that area. Okay, focus on developing yourself there. And then that is where you're going to thrive, right? So let's go over a couple of the different roles that you might see in healthcare administration. So you would say hospital administrators. So these people are overseeing operations, budgets, staffing, and everything that goes on at a hospital. Even medical billing going through insurances for the patients. And in those types of roles, sometimes you might be interfacing with the patient. You might be doing customer service. You might be the one who has to go to the patient's room and ask them about their insurance. So there might be different settings within a hospital where you actually do interface with the patient. And then there may be certain settings in which, or certain roles that you're going to play in a hospital where you do not see a patient at all. It's mostly just you working with your team. So then there are also clinic managers. I mentioned this before. Clinic managers managing day-to-day operations for outpatient facilities or specialty clinics or even free clinics can be massive. It can also be small. So your workload is what it is. Are you working with a massive team and you're doing a lot of stuff, or are you just the assistant or maybe the main manager of a small operation? There's just one physician that works there and you're just kind of managing things and it's a little bit chill. Then you have health insurance managers. These people are going to be working with payers to streamline claims, billing, coverage processes, all that kind of stuff. Maybe some people might think of them as the enemies, either way, but this is another place where you can, especially if you're a new healthcare administrator coming into the field and you really want to work on insurance, maybe you want to be the change in insurance. This might be an area where you want to go into. Next, you could get into public health administration. These people actually work for the government, whether it's federal, state, or more of a local level of government. These people are coordinating large-scale health initiatives and programs at the community or even the national level. So a lot of the local community interventions, an example of local community stuff might be organizing a health fair for members of the community to come in, and then you'll have different vendors and maybe even people providing health education for the community. That's like something that the healthcare administrator in the public sector would probably operate, right? Or even something more at the national level as well. The CDC, that would be Public Health Administration at the national level, right? Next, we have health IT administrators. Okay, so these are going to be people who work in tech. These are people who are managing electronic health records or EHRs and also ensuring compliance with data security regulations as well. So they're going to become very familiar with HIPAA regulations and how to make sure all of that is protected in the electronic systems that we use in healthcare and in the healthcare systems. Okay. Then we have long-term care facility administrators. What are they? They oversee operations at nursing homes and assisted living facilities. These types of environments. There you have it. These are probably a lot of the major categories of where you could be working in healthcare administration, but by no means is it all that healthcare administration has to offer you as a career. Okay, so there's still more and more different things you can look at and research if you are trying to decide where you want to go as a career. Okay, what would typical tasks and workloads be like? General responsibilities for a healthcare administrator in most fields or most areas would have to do with budgeting and financial planning, also policy creation, compliance with healthcare laws. You also would be working on managing the staff, scheduling payroll, human resources type tasks. And then, and of course, along with that would be hiring and training, things like that, recruiting, of course, communicating with other medical professionals like your physicians, your nurses, anyone else that you work with, all the healthcare clinicians that you work with on a day-to-day basis. Maybe they're the ones who interface with the patient and you have to be the one speaking with them. So communication is a big deal in healthcare administration as well. You're probably going to be communicating with insurance companies as well and Sometimes, depending on what roles you have in healthcare administration, you might be communicating with patients. So communication is also a huge thing that you're going to be doing in healthcare administration. Let's not forget about marketing. Okay, so many times if your facility does in-house marketing, then that is also something that you're probably going to be involved in. Okay, so examples of day-to-day work for a hospital administrator might include balancing staffing schedules, handling patient complaints, monitoring KPI, things like that. For a health IT manager, you might be ensuring an EHR system is functioning and it's addressing any kind of cybersecurity concerns and risks. You might be working in risk management if you work in IT. Okay. For an insurance manager, things you might be doing on a day-to-day basis would be like negotiating contracts with different providers and also maybe resolving claim disputes or even going through different claims and approving or rejecting, things like that. So some of the workload realities that I want to get into right now would be how fast-paced would healthcare administration be? Let's not sugarcoat this. It is, for the most part, fast-paced. I have a lot of experience working in medical records in the past. My corporate past had a lot to do with medical records, right? You work in medical records, it is very fast-paced. I know it seems like it isn't, because it seems like things move a bit slowly, but when you are working for a major corporation, you have to move very quickly and you have to be very thorough. Okay, so it's fast-paced, but you're dealing with people's medical records, medical information. So everything you do has to be extremely thorough because you do not want a lawsuit. So these are the type of realities you would have to be okay with. You're going to have to move fast, but you have to be very efficient. In healthcare, there isn't really room for mistakes because you're dealing with people's lives, people's health information, people's licenses, right? So you cannot allow yourself to be relaxed and if I don't get it, I'll get it tomorrow. Now, going into healthcare administration, you have to be on top of your game. You have to pay attention. So most of these environments are a bit fast-paced. They're deadline-driven, and you cannot make mistakes. Or you have to really try your best not to allow much error in anything that you do in healthcare, from clinicians all the way to administrators. Eliminate and reduce your error as much as humanly possible. Yeah, and then there's, of course, balancing administrative efficiency with ethical decision making, right? So you also have to think about the ethics side of everything. It's not always going to be clear, black and white. Not every situation is going to be 100% black and white. This is exactly the objective protocol that you are going to take. Sometimes you have to figure out if this is the ethical thing to do as well, because we're dealing with human beings. So that's also something that you have to balance. And it comes with time, but that's when in school, we got to learn our ethics, right? In school, studying medical ethics is actually really helpful. And communicating with your colleagues and getting advice and whatnot, right? But those are going to be some real realities that you will have to deal with in the workplace. For those of you who are in school, you're an aspiring healthcare administrator, what should you focus on other than trying to get good grades? So make sure you build strong foundations in finance, ethics, and healthcare law. Those are things that you are going to use for real, okay? A lot of what you're learning in the books, it might go like this to you because you're just trying to pass the test. And a lot of it might be too much information and you're going, am I ever going to use this? Sometimes You might not always use it, right?